Hi, everyone. I'm Rob Saffow, president of the New Jersey Association of Health Underwriters. We are privileged today to be joined not only by Steve Honig, our education chair, but also Linda Schwimmer, president and CEO of the New Jersey Healthcare Quality Institute. This will be a great session. You'll get to hear a lot of the amazing work that they do, a lot of the great work that they've done in light of the COVID situation, and how the Quality Institute's work could potentially affect you or your clients. So without further ado, Linda, thank you for joining us.
Thank you. Thanks for having me.
And Mr. Honig, would you like to start off with a few questions?
Sure. And just for our audience, we just want to share that the think tank is an institute that really brings the brightest minds and most powerful healthcare voices to its members. It's an advocacy group, and it's designed, well, actually, I'll let Linda give us more, but really it's designed to provide quality, and quality means lower costs. It's a good thing for everyone. So Linda, if you wouldn't mind, why don't we give a brief history of the organization and an overview on Healthcare Quality Institute's work and objectives.
Sure. Thank you. The Quality Institute has been around for a while. Actually, we were created in 1997. We were born out of what was called the New Jersey Healthcare Payers Coalition, so very aligned with the health underwriters who were looking for higher quality and lower costs for their membership. And then they spun off the Quality Institute as a 501c3, which we still are, very focused on safety, quality, and affordability of healthcare for everyone. We are membership funded as well as grant funded, and we really ask our members to come to our collective table, so to speak, to work on various initiatives with us that improve the healthcare system really for everyone. And I think that's what makes us particularly unique, and that's another reason why we're particularly excited to have the health underwriters at our table, because your organization, as much if not more than any other group I can think of, when you sit down with your membership and your customers, your clients, are really sort of, hearing from them and working on that same thing. How can I get them the coverage that they're looking for their employees and within their budget, which is, particularly squeezed right now, unfortunately.
Yeah.
Well, there are a lot of buzzwords that you use: accountability, quality, that are near and dear to me. And it's interesting that we've always equated higher cost means higher quality. But healthcare is one of those funny programs that higher quality tends to actually cost less money. We just have to behave differently and behave like a consumer and not simply a sheep in a herd just saying bah whenever someone says do this or do that. So are there any key projects you feel are relevant to the members of NJHCQI or to their clients?
Yes, there's actually quite a few. Let me start with quality, since you went there and it's near and dear to our heart. The Quality Institute is the regional leader for the Leapfrog Group, which is an employer-driven group that focuses on, in particular, hospital safety as well as ASCs, or ambulatory surgery center safety. We are the regional leader now, not just for New Jersey, but actually New York as well, which is new. And what we do as regional leader is we engage with all of those groups, and we work on getting them to report on their safety. And then we work with purchasers of healthcare, like health plans or the state of New Jersey, to use those safety measures in some of their incentive programs or pay-for-performance programs to really try to drive care to, and volume of care to, truly the safer, higher quality organizations. So that's one thing that we do. We also do a lot of work with policymakers, either doing research for them and then presenting them with recommendations, or giving them toolkits and resources to use to improve safety and quality throughout the state. We just worked on an initiative around maternal care during COVID, which is a great resource for not only pregnant patients, but also healthcare facilities on how to protect their healthcare workers as well as their patients, moms, infants, during COVID-19. So that's just a typical thing that we do, though, is really just whatever is needed to get people higher quality care.
That's great. And if I'm not mistaken, maternity is the #1 reason New Jersey folks spend a night or more in the hospital. It's 100,000 births a year, if I'm not mistaken.
That's right.
So obviously to be able to provide data for such an important cause for so many families is near and dear to all of us. I'm sure we know someone who's having a child or was given birth recently. Right. Also interesting to point out, just from a timeline, that we've had Amazon maybe a year and a half ago in the news creating their own healthcare entity. We've had the PCORI fee from the federal government trying to come out with better outcomes, and they've proven that that's probably one of the fees in the Affordable Care Act that makes an awful lot of sense with outcomes. And then long before that, we had the Leapfrog group, and somewhere in between that, we had your organization. So thank you for everything that you're doing. Any idea why it's important for the leaders of NJHU to stay engaged with your organization?
I really value your organization's leadership and your members' voices. I always enjoy coming to your conferences. They're always lively. But the value for me, from my perspective, is...
Besides spending time with Professor Mordo, of course.
You are the boots on the ground. So we can talk about policy till the day is long, but you see the actual effects of when a policy is changed. And I'll give an example. If the medical loss ratio is changed, or if a mandate is implemented, or if a product is no longer available, or if a new product or more flexibility is added to the market, you see how the market reacts, for better or worse. And I think that that dialogue is really important. I practiced in private practice as an attorney for many, many years. And I always draw upon that experience, whether it was as a government attorney or an attorney in a small firm. You need to know how the policy works in the real world. And I think your organization and members, more than anybody else, when it comes to health insurance, have your finger on the pulse of the real world. And I greatly appreciate that. And so when I'm working on projects, being able to pick up the phone and call one of your members or your leadership is invaluable to us. So thank you for that. And I really do think that the work that we do becomes more meaningful and valuable because of that relationship.
Well, I'm a big believer that every group is a special interest group, and what makes you somewhat more unique than any other group that I'm aware of is how welcoming you are to bringing in other partners. And if I'm not mistaken, you've got almost 100 different organizations that are members and participate and contribute.
Absolutely. We have 114 members now. And just to go back to the maternity example for a minute, you know, there's obviously different interests, but on that work group, we had everyone from a neonatologist to a doula to somebody who runs a social service agency in Newark that's, you know, helping moms with care packages for when they get home, because stores are, you know, less accessible now. So, I mean, you know, and OBGYNs and midwives and who you would otherwise expect. So I think having discussions from these multiple perspectives with that common goal in mind of look, how do we just make care better for people, more accessible and more affordable? You know, you can fill the topic in, but that's really where you get the richness of the end product, is when you have these different perspectives. And when that perspective's missing, you sometimes you just miss that one point, and the end product is lacking because of it. So I really do try to be as inclusive as possible.
How do our brokers connect their clients and the end user in this case with that type of resource? I'm talking about maternity as an example. How do we get connected to the end user?
Well, we right now have a COVID-19 resource page on our website, and we've also really pivoted all of our programming to what was a lot of in-person programming now to, obviously now to all virtual. And we've been pushing this out pretty aggressively, but would love to share that with you guys further if you haven't already seen it, and would love for all of your members to share it. We created a telehealth guide for insured regulated market here in New Jersey. So it lists every health plan in the state and what their policies are now on telehealth and telehealth reimbursement, and links to their sites so that consumers can get that information. We've developed webinars on how to have an effective telehealth visit, and how to do it both from the patient perspective as well as the provider perspective, for mental health as well as physical. We have one coming up in a couple weeks, actually, with AARP on telehealth for seniors in particular. We had one yesterday on how to refill your medications, or if you have to go into a pharmacy, stay safe when doing so. So I'd love to share all these resources with you guys. They're on this COVID-19 page of our site. But I mean, I think that's just a starter. But also, we have a newsletter that's accessible on our website, and we'd be happy to have you guys repurpose any of these materials either in your, in the Underwriters Association, or if people want to repurpose them in their own literature that they're pushing out to their clients, I'd be more than happy to have that done as well.
I think Rob has a comment.
Yeah, Linda, thanks. That's fantastic, and we'll be sure to make sure our members have easy access
Great.
those materials. And for those watching this, we are going to put a link to the Healthcare Quality Institute's COVID-19 page, right?
And Rob, our amazing technology, if you follow this screen going across, we'll put a scroll to www.njhcqi.org. There you go.
Perfect. So I just browsed that page for about 13 seconds, and there is a lot of really good resources there. Some of the things we brought up, for example, telehealth, that's been a very hot topic, as you can imagine, and there's just a whole lot of information coming from many different directions, and it's a very good compiled resource. So everyone go check that out. We will provide the link for you.
All right. In addition, Linda, to the maternity assistance, what other issues are you pushing out to New Jersey citizens as a result of COVID-19?
Well, really just a lot around safety and access while we're all dealing with the pandemic. I think that we can't emphasize this message enough, that people need to keep getting those vaccinations for their children. Keep checking in with your physician or mental health provider if you've got a chronic condition or something's coming up, you're having concerns. We can't look back a year from now and all be in miserable health and depressed. We have to continue to take care of ourselves, and we also have to, I think we're going to start focusing a little bit more moving forward on health literacy and trusted resources. I think people really need to go to the right places for true facts and science. I mean, we really, it's important right now that we have those trusted resources and maintain our health, probably more than any time else. Another thing that I asked all of my staff to do, and I'm doing, is we're really looking at all of the changes that are being made right now to the healthcare industry, and there's many of them, and they're every single day. And we're looking at the ones that are probably the silver lining of this whole thing and make sense, telehealth being one of them from my perspective. But we're also looking at some of the requirements that were taken away that will need to be reimposed, and there probably will be some pushback. And I'm thinking of certain quality reporting and things like that. We made really great strides when it came to some transparency and quality reporting, and I don't think we want to lose ground on those things. So those are just some of the things moving forward that we're thinking about right now and keeping track of.
Well, we're coming up to our time limit. We've got one more question. What's next in store for the organization?
We are really, we were concerned before, but I'm even more concerned about New Jersey's small employer market. And I think that goes hand in hand with the individual market as well. I mean, there's so much crossover when you're thinking about a small employer. And I think we have some new opportunities with the state having its own exchange coming up this fall. So we're looking at what would a value-based best evidence plan look like. A lot of the plans that we have, a lot of the mandates that we have in place, those were developed really over, since 1993. And a lot of the assumptions that were made, I think, need to be revisited and re-looked at. It would take some federal waivers and approvals and things like that, maybe some loosening from the metallic tier and cost sharing that we have today. But I think this is a really important project. I think and it falls in line with everything we've been talking about around primary care, preventive care, investing in care that matters, the Choosing Wisely campaign, things like that. We really need to be thinking about plans that cover a lot more for the care that is more valuable and maybe less for other things. So sort of a preventive with a catastrophic sort of design. So that's something I think we're going to be looking at pretty closely over the next year. And I think a partnership with you guys on that and getting your input would be again very valuable, because you know what your members are really looking for in a product, and I think that something like this would be of great value to a lot of them, and hopefully less expensive. I mean, that's certainly the goal.
Yeah. Thank you,
Linda. Thank you so much. That initiative definitely rings a bell with some of the work that we are doing at the Health Underwriters. As far as the state-based exchange goes, we are currently working with the Department of Insurance to see where our input could be best used. One of the things we'll be working on is an agent training program to make sure our agents are certified and the right resources are out there for them. But in terms of what you said around the different plans and regulations and mandated benefits, what makes sense and what doesn't, we have some really good conversations within our association as to the unforeseen consequences when such and such regulation was put into place or a benefit was mandated. So we would absolutely love to be at the table and provide you with the folks within our association that are the true experts in that segment. And I think together we could do a lot of really good work.
Great. Yeah. Thank you.
Absolutely. Thank you. And Looks like we're coming to about the top of the hour. Steve, did you have any more questions for Ms. Schwimmer?
I think we're all set, other than the fact that on the last topic you just talked about, we could probably do a session just around that one. So now we have food for thought for the next time we meet.
Okay.
Thank you
Linda,
so much for sharing.
thank you so much. Thank you for your time. Steve, thank you for your time. And again, to the members of NJHU or anybody watching this broadcast, the link for the New Jersey Healthcare Quality Institute will be below in the description, or sliding across if we could get that to work. So on behalf of the New Jersey Association of Health Underwriters and the New Jersey Healthcare Quality Institute, thank you everybody for joining today's conference.
Thank you. Stay safe.
Bye-bye.
Thanks, Linda.
Bye.
Take care. Bye, guys.